Question 1. A patient with diabetic ketoacidosis, DKA, is admitted. Which finding is expected? A. Low blood glucose. B. Fruity breath odor. C. Bradycardia. D. Weight gain. Correct answer. B. Fruity breath odor. Rationale. DKA causes ketone production, which leads to fruity, acetone, breath odor. Strategy. DKA equals ketones equals fruity breath. Question 2. Which lab finding is expected in HHS, hyperosmolar hyperglycemic state? A. Blood glucose 90 mg per deciliter. B. Severe hyperglycemia. C. Low serum osmolality. D. Ketones present. Correct answer. B. Severe hyperglycemia. Rationale. HHS is characterized by very high blood glucose, greater than 600 mg per deciliter, with minimal or no ketones. Strategy. HHS equals high sugar, no ketones. Question 3. Which symptom is most common in DKA? A. Slow breathing. B. Kussmaul respirations. C. Bradycardia. D. Hypotension only. Correct answer. B. Kussmaul respirations. Rationale. DKA causes metabolic acidosis, leading to deep rapid breathing, Kussmaul respirations. Strategy. DKA equals acidosis equals deep breathing. Question 4. Which is priority treatment for DKA? A. Insulin. B. Oral glucose. C. Sodium bicarbonate first. D. Potassium first. Correct answer. A. Insulin. Rationale. Insulin stops ketone production and lowers blood glucose. Strategy. DKA equals insulin first. Question 5. Which patient is most likely to develop HHS? A. Type 1 diabetes patient. B. Type 2 diabetes older adult. C. Child with diabetes. D. Pregnant patient. Correct answer. B. Type 2 diabetes older adult. Rationale. HHS occurs mostly in older adults with type 2 diabetes. Strategy. HHS equals type 2 plus elderly. Question 6. Which electrolyte imbalance is common in DKA? A. Hypercalcemia. B. Hypokalemia. C. Hypermagnesemia. D. Hypernatremia. Correct answer. B. Hypokalemia. Rationale. Insulin therapy pushes potassium into cells, causing hypokalemia. Strategy. DKA treatment equals potassium drops. Question 7. Which sign is more common in HHS than DKA? A. Fruity breath. B. Severe dehydration. C. Kussmaul respirations. D. Metabolic acidosis. Correct answer. B. Severe dehydration. Rationale. HHS causes extreme dehydration due to very high glucose levels. Strategy. HHS equals very dehydrated. Question 8. Which lab finding indicates DKA? A. Normal pH. B. High ketones. C. Low glucose. D. Low potassium. Correct answer. B. High ketones. Rationale. DKA is characterized by ketone production. Strategy. DKA equals ketones present. Question 9. Which symptom is expected in HHS? A. Kussmaul respirations. B. Fruity breath. C. Altered mental status. D. Abdominal pain. Correct answer. C. Altered mental status. Rationale. HHS causes severe dehydration leading to confusion. Strategy. HHS equals confusion. Question 10. Which is priority in treating HHS? A. Insulin immediately. B. Fluid replacement. C. Sodium restriction. D. Oral glucose. Correct answer. B. Fluid replacement. Rationale. HHS patients are severely dehydrated, so fluids come first. Strategy. HHS equals fluids first. Question 11. Which finding suggests DKA? A. No ketones. B. Metabolic acidosis. C. Normal glucose. D. Hypercalcemia. Correct answer. B. Metabolic acidosis. Rationale. DKA causes metabolic acidosis due to ketones. Strategy. DKA equals acidosis. Question 12. Which symptom is expected in DKA? A. Slow breathing. B. Nausea and vomiting. C. Weight gain. D. Bradycardia. Correct answer. B. Nausea and vomiting. Rationale. DKA causes GI symptoms due to acidosis. Strategy. DKA equals GI upset. Question 13. Which patient is at risk for DKA? A. Type 2 diabetes. B. Type 1 diabetes. C. Hypertension. D. Asthma. Correct answer. B. Type 1 diabetes. Rationale. DKA occurs mainly in type 1 diabetes. Strategy. DKA equals type 1. Question 14. Which lab value indicates HHS? A. Glucose 120 mg per deciliter. B. Glucose 650 mg per deciliter. C. Glucose 80 mg per deciliter. D. Glucose 90 mg per deciliter. Correct answer. B. Glucose 650 mg per deciliter. Rationale. HHS typically has very high glucose. Strategy. HHS equals greater than 600 glucose. Question 15. Which sign indicates improving DKA? A. Increased ketones. B. Normal pH. C. Increased glucose. D. Kussmaul respirations. Correct answer. B. Normal pH. Rationale. Normal pH indicates resolution of acidosis. Strategy. DKA improves when pH normalizes. Question 16. Which assessment finding is priority in DKA? A. Dry skin. B. Kussmaul respirations. C. Nausea. D. Fatigue. Correct answer. B. Kussmaul respirations. Rationale. Kussmaul respirations indicate metabolic acidosis, which is life-threatening. Strategy. Airway and breathing first. Question 17. Which fluid is typically given first in DKA? A. Dextrose 5%. B. Normal saline. C. Lactated ringer. D. Half normal saline. Correct answer. B. Normal saline. Rationale. Normal saline restores circulating volume. Strategy. DKA equals fluids first. Question 18. Which symptom is more common in DKA than HHS? A. Severe dehydration. B. Fruity breath. C. Confusion. D. Very high glucose. Correct answer. B. Fruity breath. Rationale. Ketone production occurs in DKA, not usually in HHS. Strategy. DKA equals ketones. Question 19. Which lab value requires immediate attention? A. Glucose 250 mg per deciliter. B. Potassium 2.9 milliequivalent/L. C. Sodium 135 milliequivalent/L. D. Chloride 100 milliequivalent/L. Correct answer. B. Potassium 2.9 milliequivalent/L. Rationale. Low potassium can cause fatal arrhythmias. Strategy. Low potassium equals danger. Question 20. Which symptom indicates severe dehydration? A. Moist skin. B. Dry mucous membranes. C. Increased urine output. D. Warm skin. Correct answer. B. Dry mucous membranes. Rationale. Dry mucous membranes indicate dehydration. Strategy. Dry equals dehydration. Question 21. Which medication is used to treat DKA? A. Regular insulin. B. Metformin. C. Glipizide. D. Glyburide. Correct answer. A. Regular insulin. Rationale. For regular insulin is used to treat DKA. Strategy. DKA equals for regular insulin. Question 22. Which symptom is expected in HHS? A. Ketones present. B. Severe hyperglycemia. C. Metabolic acidosis. D. Fruity breath. Correct answer. B. Severe hyperglycemia. Rationale. HHS causes extreme hyperglycemia. Strategy. HHS equals very high sugar. Question 23. Which lab value indicates DKA? A. pH 7.35. B. pH 7.25. C. pH 7.40. D. pH 7.45. Correct answer. B. pH 7.25. Rationale. DKA causes metabolic acidosis, low pH. Strategy. DKA equals low pH. Question 24. Which symptom is common in HHS? A. Abdominal pain. B. Confusion. C. Fruity breath. D. Kussmaul respirations. Correct answer. B. Confusion. Rationale. Severe dehydration causes neurological symptoms. Strategy. HHS equals mental status changes. Question 25. Which finding indicates worsening DKA? A. Decreasing glucose. B. Increasing ketones. C. Normal pH. D. Improved breathing. Correct answer. B. Increasing ketones. Rationale. Increasing ketones indicate worsening acidosis. Strategy. More ketones equals worse DKA. Question 26. Which symptom is most common in DKA? A. Bradycardia. B. Polyuria. C. Weight gain. D. Hypoglycemia. Correct answer. B. Polyuria. Rationale. High glucose causes osmotic diuresis, leading to frequent urination. Strategy. High sugar equals P more. Question 27. Which finding indicates HHS? A. Ketones present. B. Severe dehydration. C. Fruity breath. D. Metabolic acidosis. Correct answer. B. Severe dehydration. Rationale. HHS causes extreme fluid loss. Strategy. HHS equals dehydration. Question 28. Which lab finding is expected in DKA? A. High pH. B. Low pH. C. Normal pH. D. Alkalosis. Correct answer. B. Low pH. Rationale. DKA causes metabolic acidosis. Strategy. DKA equals acidic. Question 29. Which symptom suggests hyperglycemia? A. Diaphoresis. B. Polyuria. C. Shakiness. D. Confusion only. Correct answer. B. Polyuria. Rationale. High glucose causes frequent urination. Strategy. Hyperglycemia equals P more. Question 30. Which is priority during DKA treatment? A. Monitor potassium. B. Monitor temperature. C. Monitor weight. D. Monitor skin. Correct answer. A. Monitor potassium. Rationale. Insulin therapy causes potassium shifts. Strategy. DKA equals watch potassium. Question 31. Which symptom indicates metabolic acidosis? A. Slow breathing. B. Kussmaul respirations. C. Bradycardia. D. Hypertension. Correct answer. B. Kussmaul respirations. Rationale. Deep rapid breathing compensates for acidosis. Strategy. Acidosis equals deep breathing. Question 32. Which patient is most at risk for HHS? A. Young type 1 diabetic. B. Older type 2 diabetic. C. Pregnant woman. D. Child with diabetes. Correct answer. B. Older type 2 diabetic. Rationale. HHS mainly occurs in older type 2 patients. Strategy. HHS equals elderly type 2. Question 33. Which symptom indicates DKA? A. No ketones. B. Abdominal pain. C. Bradycardia. D. Weight gain. Correct answer. B. Abdominal pain. Rationale. DKA often causes abdominal pain. Strategy. DKA equals GI symptoms. Question 34. Which intervention is priority in HHS? A. Insulin first. B. Fluid replacement. C. Sodium restriction. D. Bed rest. Correct answer. B. Fluid replacement. Rationale. HHS patients are severely dehydrated. Strategy. HHS equals fluids first. Question 35. Which lab finding indicates HHS? A. Glucose 100 mg per deciliter. B. Glucose 650 mg per deciliter. C. Glucose 90 mg per deciliter. D. Glucose 110 mg per deciliter. Correct answer. B. Glucose 650 mg per deciliter. Rationale. HHS has extreme hyperglycemia. Strategy. HHS equals greater than 600 glucose. Question 36. Which symptom suggests DKA? A. Fruity breath. B. Weight gain. C. Hypoglycemia. D. Bradycardia. Correct answer. A. Fruity breath. Rationale. Ketones cause fruity odor. Strategy. Fruity breath equals DKA. Question 37. Which sign indicates dehydration? A. Moist skin. B. Dry mucous membranes. C. Edema. D. Weight gain. Correct answer. B. Dry mucous membranes. Rationale. Dry mucous membranes indicate dehydration. Strategy. Dry equals dehydration. Question 38. Which medication treats DKA? A. Regular insulin. B. Metformin. C. Glipizide. D. Glyburide. Correct answer. A. Regular insulin. Rationale. For regular insulin is used in DKA. Strategy. DKA equals for insulin. Question 39. Which symptom indicates HHS? A. Ketones. B. Confusion. C. Fruity breath. D. Acidosis. Correct answer. B. Confusion. Rationale. Severe dehydration causes mental changes. Strategy. HHS equals confusion. Question 40. Which finding indicates improving DKA? A. Decreasing glucose. B. Increasing ketones. C. Low pH. D. Kussmaul respirations. Correct answer. A. Decreasing glucose. Rationale. Lower glucose indicates improvement. Strategy. Glucose down equals improving. Question 41. Which finding is most concerning in DKA? A. Mild thirst. B. Fruity breath. C. Lethargy and confusion. D. Increased appetite. Correct answer. C. Lethargy and confusion. Rationale. Neurological changes indicate worsening metabolic imbalance and dehydration. Strategy. Confusion equals severe DKA/HHS. Question 42. Which lab value is expected in DKA? A. High bicarbonate. B. Low bicarbonate. C. Normal pH. D. High pH. Correct answer. B. Low bicarbonate. Rationale. Bicarbonate is used up buffering acids metabolic acidosis. Strategy. DKA equals low HCO3. Question 43. Which symptom is common in HHS? A. Fruity breath. B. Severe dehydration. C. Kussmaul respirations. D. Ketones present. Correct answer. B. Severe dehydration. Rationale. HHS causes extreme fluid loss without ketones. Strategy. HHS equals dry patient. Question 44. Which is a priority nursing action in DKA? A. Give oral glucose. B. Start 4 fluids. C. Encourage eating. D. Restrict insulin. Correct answer. B. Start 4 fluids. Rationale. Fluids restore circulation and perfusion first. Strategy. DKA equals fluids before anything else. Question 45. Which finding indicates DKA resolution? A. High ketones. B. Normal anion gap. C. Fruity breath. D. Low pH. Correct answer. B. Normal anion gap. Rationale. Closing anion gap shows ketone clearance. Strategy. DKA improves when acidosis resolves. Question 46. Which patient is at highest risk for DKA? A. Type 2 diabetic with infection. B. Type 1 diabetic missing insulin. C. Elderly type 2 diabetic. D. Non-diabetic patient. Correct answer. B. Type 1 diabetic missing insulin. Rationale. DKA occurs due to absolute insulin deficiency. Strategy. DKA equals type 1 plus no insulin. Question 47. Which symptom indicates HHS? A. Kussmaul respirations. B. Confusion. C. Fruity breath. D. Ketones in urine. Correct answer. B. Confusion. Rationale. Neurological symptoms occur due to severe dehydration. Strategy. HHS equals brain affected. Question 48. Which lab finding is most likely in HHS? A. pH 7.20. B. Ketones present. C. Glucose greater than 600 mg per deciliter. D. Low sodium only. Correct answer. C. Glucose greater than 600 mg per deciliter. Rationale. HHS is defined by extreme hyperglycemia. Strategy. HHS equals very high sugar. Question 49. Which intervention prevents complications in DKA? A. Monitor potassium. B. Encourage sugar intake. C. Restrict fluids. D. Stop insulin early. Correct answer. A. Monitor potassium. Rationale. Insulin causes potassium shifts risk of arrhythmias. Strategy. DKA equals watch K plus closely. Question 50. Which finding shows improving HHS? A. Worsening confusion. B. Stable glucose and improved hydration. C. Increased ketones. D. Fruity breath. Correct answer. B. Stable glucose and improved hydration. Rationale. Recovery is shown by hydration and glucose control. Strategy. HHS improves when fluids plus sugar normalize.